Support for Headline Humboldt is made possible in part by viewers like you. Thank you.
Coming up next on Headline Humboldt, a young man and Eureka High School student was arrested this week for possession of explosives, a ghost gun, and ammunition in his vehicle on campus. Police say there was no obvious intent to attack. Also, Executive Director Amanda LeBlanc from the North Coast Rape Crisis Team joins us to talk about a proposed state budget that could leave some local victims of violence in the lurch. Coming up now on Headline Humboldt. From the top of Humboldt Hill, this is Headline Humboldt. I'm James Falk. Thanks for joining us. If you've ever needed medical or dental care in Humboldt County, especially if you're poor or have special medical considerations, you know that our system leaves a lot to be desired. My family has to travel some 5 hours to the south when we need certain kinds of dental care. That means a day off from work, wear on the car, possibly a hotel room, and other inconveniences just to get relatively normal kinds of dental interventions. Those costs and inconveniences add up, and we're not the only ones, obviously. Humboldt County has long struggled with a dearth of doctors and other medical professionals after the bulk of our professional cadre retired some years ago. For a while, we were just seriously short-handed, but recently some progress has been made with provident and local organizations like Open Door Community Health Centers working hard to see these issues addressed. But while the numbers have gone up somewhat, we're now treated largely by a class of young doctors, low on experience, many of whom have no interest in staying here long-term. And according to 4th District Supervisor Natalie Arroyo, even more difficulty may be in the offing as the number of incoming U.S. medical students continues to drop. Believe it or not, though, according to many, for a rural area, Humboldt County is doing pretty good, and we'll hear more about that in a moment. But tonight's interview involves another potential crisis. The governor's proposed budget for the upcoming fiscal year seems set to leave some violence victims in the lurch. We'll be joined by North Coast Rape Crisis Team Executive Director Amanda LeBlanc to examine what that might look like. First, the news. On Wednesday at around 10:30 a.m., a Eureka High School official was walking on Del Nord Street adjacent to the campus when they noticed a container of suspected tannerite on the dashboard of a vehicle belonging to a student. Tannerite is used for targeting. It's a binary explosive and it's illegal to possess in California. EHF's staff contacted the Eureka Police Department, who later responded to the scene. Upon their arrival, officers confirmed the presence of tannerite and secured the vehicle while a warrant was obtained to search it. The Humboldt County Sheriff's Explosive Ordnance Team responded to assist with the investigation, and once the warrant was obtained, officers conducted a search of the vehicle, ultimately seizing and searching the container or securing the container of tannerite. Also during the search, investigators found and seized a pistol with no serial number, a loaded pistol magazine, several hundred rounds of ammunition, and magazines for a .223 caliber rifle. The suspect is an 18-year-old student who was secured by school staff and officers, then arrested on suspicion of the following: possession of explosives without a permit, possession or transporting explosives, possession of a concealed firearm in a vehicle, possession of a non-serialized firearm, and possession of a firearm in a school zone. The suspect, identified as Ivan Gunnar Hatch Logan from Eureka, was booked into the Humboldt County Correctional Facility. The investigation did reveal that there was no threat or intent to use these items against students, staff, or the campus. EPD was able to secure the vehicle and the situation without placing the school on lockdown or disrupting the school day. At Tuesday's board meeting, 4th District Supervisor Natalie Arroyo presented some sobering figures about how the recruitment and retention of medical providers in Humboldt County and elsewhere is a massive problem. Arroyo's presentation was a preview of a community meeting scheduled for January 27th, when industry leaders will meet with the public to discuss the situation. Arroyo interviewed more than 40 experts to develop her presentation, and its conclusions were somewhat surprising. Challenges for the region include a housing shortage as well as a dearth of clinic space, poverty levels both real and apparent, long-running woes surrounding insurance reimbursement and the cost of administration, and a national shift where fewer people are becoming doctors while those that do require a better home-life balance, which Humboldt County has a hard time providing. According to Arroyo, there will be a projected shortfall nationwide by some 85,000 providers in about 10 years.
So we are in a circumstance where there's a healthcare provider shortage nationwide. And when I say healthcare provider, I am referring to doctors, nurse practitioners, and physician's assistants. Although there are many, many more folks in the healthcare community who have a critically important role, that was the focus of this particular series of interviews. So within about 10 years, we're going to be facing a physician shortage in the U.S. of over 85,000 physicians, and that's from the American Association of Medical Colleges. And that's not accounting for the already underserved areas. So to reach equity with the more served areas, it would be 5 times that. So it's quite a shortfall that we're facing. That was staggering to me. And more than 40% of physicians in the United States are 55 or older. That labor projection, there isn't a ton of hopeful news when we look at our demographics, because as a result of the 2006 to 2008 financial crisis, there's a pretty steep birth rate decline, and that hasn't really picked up since. So there is quite a decline in the percentage of folks who are anticipated to go to college starting really about this year, because we're hitting that kind of demographic cliff. So there's a concern that there aren't, there's like a 15% reduction projected for people going to college or getting through some of that, preliminary coursework just to be able to go to medical school. So that's quite dire. And then there's a percentage of population here that's higher than usual that is not in the workforce, either folks who are retired, disabled, or for whatever other reason not working. And these shortages are much more pronounced in rural areas. So the bottom bullet might be surprising to people. I had many folks tell me that we are in much better shape than many rural areas, and that we enjoyed a very unique abundance of medical providers for many years, and that has fallen off for some key reasons. But many folks emphasized to me that while it is incredibly important to focus on recruitment and retention, that we're in better shape than many places.
There are limited seats available to attend the upcoming panel discussion in person, but the event will be live streamed via Access Humboldt's YouTube page, and the online audience will be invited to engage via an online polling platform. We'll be right back after this short break.
This is the PBS app. It's ready for you whenever you want full episodes of your favorites, perhaps a little history, or the real story, shows with heart, or the latest news and docs. Even stream your local station live. It's all there waiting for you. So download the PBS app now for everything you love and a whole lot more to explore. Stream anytime, anywhere with the PBS app.
Life is complicated enough. Why worry about what to do with your extra car? Skip the costs of maintaining it, storing it, insuring it, or renewing registration. Car repairs? Forget about it. Here's one easy solution to your car problem. Donate it to our station. It's fast, free, tax deductible, and if you donate, you're going to feel incredible knowing you're supporting quality programming. Interested? Just call this toll-free number or donate online. Thank you.
Joining us now in studio is Amanda LeBlanc, Executive Director of the North Coast Rape Crisis Team. Thanks for joining us.
Thank you for having me.
So there's a long list of circumstances that have brought you here tonight, but
Yep.
Let's start with the value of your organization, which is quite high. We've just had a sort of a long conversation about it. The North Coast Rape Crisis Team, what does it do, and what does its impact on the community look like for folks who may not be aware?
Yeah. The North Coast Rape Crisis Team is the only rape crisis center for both Humboldt and Del Norte counties. We serve survivors and significant others of sexualized violence 24 hours a day, 365 days a year, mostly through our crisis line, but also we respond out to every single law enforcement report, every medical forensic interview, which is known as the rape kit. We're by someone's side when we do that. When they do that, we provide peer counseling services, advocacy services, and accompaniment services, and all the way through the criminal justice process and beyond. You don't have to engage in the criminal justice process in order to have our services. We also are at every single sexual abuse disclosure, child abuse services team interview, and we also in the past have had prevention education services where we would go out into schools and community events. And unfortunately, that funding has already ended. So that program is no longer.
And that would be like the value of consent and respect and that sort of thing?
Healthy boundaries, respect, human trafficking awareness, and absolutely the tenets of consent. And we do that from preschool basically all the way up until talking to professionals. And unfortunately, that funding has already ended.
And that's what we're here to talk about is the funding situation.
Yeah.
But first, I mean, give us a sense of what the numbers look like in terms of how many people you are serving every year and what that service looks like in terms of on the ground. What are victims in Humboldt County facing primarily from your perspective?
Yeah. So when a survivor comes forward, there are many different things that can happen to them. So if they decide to report to law enforcement, that can be a 6 to 8 hour process, as can the evidence collection. And they're legally able to have an advocate by their side. So my staff, which is 9 full-time staff, and I have about 8 part-time staff, cover both Humboldt and Del Norte County with a 20-minute response time. Wow. 365 days a year. 24 hours a day.
Which is better than some emergency departments, I think.
Yeah, probably, yes.
No offense.
Yes. So, and we can stay for as long as they need. So sometimes we're out for 12 hours with someone, making sure that they get water and food, and we give them a hygiene kit. And clothes to wear home, because you don't go home in your clothes when you get evidence collected. And then an advocate follows up with them the next day, and we start talking about, what do you need? Do you need emergency housing? Can you not go home? The person who committed this violence might be the breadwinner in a home, and so we're able to do some flexible funding assistance for rent and other things in some cases. We then follow them through. We are the liaison between law enforcement, the district attorney's office, and other places, and really help set expectations about how long this process happens. Because although we have the technology of CSI and Law and Order Special Victims Unit, it can take between 18 months and 3 years for a prosecution of a case like this to happen. Yeah. We also support family members, because most people don't even know that we are a service until they need us.
Yeah, yeah.
And so helping parents and children to rebuild their families, to heal the rifts, to figure out what happened, how was this person in their lives, and then to rebuild and heal. And that never ends. So, you know, we've been a service for 43 years, and there are people who have called us since day one who still do.
Yeah.
And it's really just an empathetic, non-judgmental ear who happen to have a lot of information about something that not a lot of people want to think about.
Yeah, yeah. And you guys are basically like it's an advocacy group for this vulnerable population. Yes. And help them achieve healing in a situation that can be very, very obviously traumatic and violent.
Absolutely, yeah.
Everything else. Now, interestingly, we were talking about funding, and the bulk of the funding comes from the federal government, but it comes from a particular kind of fund.
Yes.
Can you describe for us how the funds depend on other people doing wrong?
Yes, absolutely. Yes.
Yeah.
So the funding stream comes from the federal VOCA monies, which is the Victims of Crime Act. And so that's not taxpayer money. It's not a bond. It's not anything like that. It's based on corporate malfeasance and then corporate bad actors paying the fines and fees that they are sentenced to. And over the last 3 to 5 years, that has become, it's at a critically low level. And so Congress has not allocated the funds that victims of crime organizations, not just the North Coast Rape Crisis Team, but many others, need in order, and we counted on that as our baseline funding. Yeah. And I just want to say that was never enough to meet all of the needs that survivors have.
Yeah. You were barely having enough to get through, and now that's gone down, and that's just because crimes aren't getting prosecuted, basically, or investigated. And I mean, whatever the mechanism is politically behind it, it just less money's coming in, so it's not coming to you guys.
Yes, absolutely.
Okay.
And so, and it is at a critically low level where we are looking at a 44.7% cut in October of 2025.
Yeah.
We were anticipating that cut in October of 2024, but Governor Newsom put in a line item of $103 million, which offset about 98% of what we needed in order to get back to that original baseline of funding. The governor's budget came out on Monday. That funding is not there.
Yeah.
And so survivors of not only sexualized violence, but domestic violence, children who are in foster care.
Yeah, because this money goes to support all of those victims.
Of those funds.
And that's,
yes.
it's like, it's not, so it's going to be a wall up across the board.
Yes.
It's really horrific scenario.
It is. Yeah. We're looking at, I would say, easily over a $2 million loss just to Humboldt County.
Yeah. Wow. Now, so you guys are making an ask of the governor to put that money back in. Now, there's a long-term fix coming, which is the state of California is establishing its own crime victims fund,
Yes.
right? But it's going to be based on the same sorts of things.
Yes.
So, and as I pointed out, I mean, I'm glad that there's money potentially going to be available for these programs, but at the same time, making, programs that are integral for helping people survive violent crime dependent upon other people breaking the law just seems like flawed logic to me. But
not only breaking the law, but then paying the money that we're owed in order to have services,
yeah, exactly.
right?
Making good on it.
Yes,
which, I mean, some of those people
yes.
won't, so you're never going to see that money. Yeah,
That's absolutely right. Yes. Yeah. And so when that happens, so there is no generalized fund for victims of crime that allows our services to always continue.
Yeah.
And I can tell you that our dedicated staff, not everyone wants to do this work.
Sure.
And the people that do, we invest a lot of time in training and other things. They are certified by the state to do this work well.
Yeah.
And it is heartbreaking to think that we will be operating with half of those people, and then in 5 years, when that funding comes, I'll have to start all over again.
Yeah, exactly, and build from the bottom of
Absolutely.
anything. You're already having to lay some people off, is that correct?
Yes, absolutely. Our loss of our prevention education funds has already cost a member of our team, and it is a devastating loss for an amazing advocate, an amazing educator, and someone who would have probably done this work for the rest of their life.
Wow. So what's the governor's office reaction? Have you reached out to Mike McGuire, who was our local senator, as well as being someone up on the upper echelons of state power?
Yes. So we have relationships with our local representatives. We rely upon Valor US to do the lobbying on our behalf because we're nonprofits. We can't. There are lots of rules about those things. Sure. But really, what we know is that money might come through, but we need Humboldt County to get involved.
Yeah.
We need our community to give what they can, and to, all of our representatives have heard from us over and over again about how much we need these funds.
Yeah.
But who they want to hear from are other people who either are affected or not affected by this issue, who think that the North Coast Rape Crisis Team, Humboldt Domestic Violence, court-appointed special advocates should exist.
Yeah.
And we need people to sign on to support letters for that. And those are on our website.
Okay. And the website is ncrct.org.
That's
correct?
right.
Yep. And there's also an opportunity there for people if they wanted to donate to your organization, which
Absolutely.
would also be helpful, I assume.
Absolutely, yes. We always need donations. There are so many things that survivors need that grants don't pay for to begin with, right? So, if someone needs, for example, their tires get slashed by someone, there isn't really a grant that pays for that.
Yeah.
But we can use donations and general funds in order to make sure that person is whole, so that they can stay in the workplace, so that they can get their child.
Because there's no conditions attached to it.
It's exactly
like a general fund that you can actually do whatever discretionary funds.
Exactly. Yes. Discretionary funds that go completely to survivors.
Yeah.
And so yes, we absolutely need that. We need donations. We would love it if people could make donations on an annual or a monthly basis, so that we can understand what our budget looks like and how we can serve survivors from year to year. But we're in a crisis situation right now. Yeah. And we need help.
And those monthly options and stuff would be available on the website?
They are all on the website.
Yeah. Okay.
Yep.
Just to get a little bit more sort of locally focused, what kind of assaults do we see a lot of in Humboldt County? What does that look like? And are we any worse off demographically for those types of things than other counties, or are we somewhere in the middle? Where do we stand?
Well, so people who, use public services, and that's where my statistics come
Sure.
from,
Yeah.
tend to sway to a lower income level.
Yeah.
Because if you have money and can, end a marriage, let's say, or move out of a place and you don't need help from people, you're going to do that
You have
without.
options.
Yeah,
Yeah.
exactly, if you have options. However, I can tell you that I've worked all across Northern California, and Humboldt County is really, there's no difference.
Okay.
We see the same kinds of survivors. So we serve child sexual abuse survivors, whether that is through a family member, someone that they know and that they love, or a stranger. We work very closely with Cal Poly Humboldt and College of the Redwoods. We are the advocacy team for college campuses, so we see a fair amount of drug-facilitated assaults that happen. And, really anyone who is alive is at risk of having sexual assault happen to them. It's not based in gender, it's not based in income. And we certainly have people, and just in Humboldt County, we served over 400 survivors last year. 85 of those were children.
Yeah.
So we are busy.
Yeah. Well, and you said you had how many? 9 full-time employees?
We do. We have 9 full-time
And you're available 24 hours a day,
That's
7
right.
days a week. So, I mean, you can just do the math and see how stretched thin that might get. But it's also important, I think, for people to understand the value of like your guys' intervention. I have family members who were victims of sexual assault, and I've seen what they've gone through without. I mean, this was generations ago, so they didn't necessarily get the help that they needed.
Right.
And their lives became much more difficult, much more complicated, and a lot of times they never really emotionally recovered. And that's through no fault or weakness of their own.
Right.
There was just nothing around them like this at the time to help. And so I think that I want to just underline the point that like having support in these moments where people can internalize things, they can take on a lot of self-blame or shame about something, and as you were saying before, the shame goes to the perpetrator, and that's where we need to make sure.
Yeah.
Another quick point is that I think a lot of people probably think that it's the police department's job to call the North Coast Rape Crisis Team. Like if something happens, but that doesn't have to be the case, right?
No, absolutely not. Yeah, our 24-hour crisis line is available for anyone. We, law enforcement are great partners, and they are legally required to call an advocate when someone wants to report sexualized violence, and they do. But anyone can reach out to us, and we can help you to help make the report when you're ready. We can help you to make sure that, we can get you a gas voucher in order to get there. There are things that we can do in order to make it a little bit easier. And then the way that we work most of the time is a vertical process, which means that if I'm the advocate who shows up, then I'm your advocate. And then I'm the person who goes with you.
So you don't have to keep reintroducing yourself
exactly
or your crime to other people. It'll always be you can form a relationship with somebody.
And relationship making is so important to this work. And also just because it takes a really long time for survivors to come to the place where they're out of that shame and guilt, and it may never happen, but they're out of that shame and guilt where the perpetrator may be held responsible or not held responsible, but finding out what justice means to you and what healing means to you, and then having someone who's my job is not to investigate crime. My job is not to interview anyone. My job is to sit with the survivor and say, what do you need and how can I help you today? And I can do that for as many hours as it takes and for as long as it takes. And that's another reason why these cuts to our staff are so devastating. Because each one of us we're case carrying advocates. And so we're having to tell them, I'm sorry.
It's a bunch of relationships that are suddenly cut off.
Absolutely.
To have to start again or
and
not.
The impact on that is that if you don't have your advocate, you may not want to testify in court. If you don't have your advocate, you might want to self-harm or do other things because you can't reach the person who believes in you. And those are real things that happen every single day that we're doing that both preventative work and intervention work for survivors. And I do want to say also for significant others. So we have relationships with moms and dads and aunts and uncles in order to make sure that they believe the survivors who are in their life, that they are supporting them, and that we are also supporting how hard it is to have this happen in your family.
So you're not necessarily just helping the victim, but also people that are around the victim. Talk a little bit about, if you don't mind, about the impact that this can have on you guys personally as employees of the team. I'm sure that can be traumatic at times. How do you cope with that? What gets you through?
We do a lot of self-care. We do a lot of self-care. We have a really great process of mentoring and also casing. So we talk about the cases a lot. You know, there's a fair amount of tears, I will say that, but there's also a fair amount of awe in what we see. You know, our role is to see the resilience in humans and to watch healing happen and to walk beside someone as they make a new life. And it is a beautiful thing to watch. And we get to do it every day.
Yeah.
And so we're a strong team of people who kind of, you know, we get to open up the curtain and see what's inside and, you know, some of the most horrific things that happen in a community. But we also get to be with someone and give them a path out of the darkness and stand beside them as they figure out what that is. And it's, you know, we are having an upcoming fundraising event, and it's really to celebrate the resilience of survivors. That's
coming up in April, right?
In April, yes. April 5th, our Dancing in the Rain Gala.
Okay, where is that going to be, and how can people get tickets? Probably your website.
The website is where you want to be, but it is, it's going to be at the Sequoia Conference
Center. You can see it
Center.
on your screen now, yeah, Dancing.
There it is, Dancing in the Rain Gala. And we've booked the undercovers for a night of dancing and fun. And so please come, get tickets. If you have a business that would like to sponsor, we need sponsorships in order for this event to happen.
Okay.
And we really want and need the community to come out and really show survivors that we're behind them.
Yeah, that's fantastic. Hopefully we can get some folks out there. It sounds like it's going to be a good time.
It's going to be a great night.
Now, real quick, what's the hotline number if people needed to call that? Or
yeah, great question. So that's 707 443 2737.
443-2737, area code 707. Okay,
Yep.
So that's for anybody who has suffered in sexual assault.
Yep.
Is there any referrals that go on, or should you only call if you are calling about your own experience?
Oh, no, absolutely
Okay.
not. So we love to hear from community members. We love to hear from significant others. And it doesn't have to be an acute thing. It can just be, it could be something that happened to you years ago and you see something on TV, or you just really need a little bit of a tune-up and somebody to validate your experience.
Yeah.
You know, we received over 4,000 calls on our hotline last year.
Yeah.
So,
Wow.
you know, we are available and ready to talk.
You know, we got 45 seconds left.
Yeah.
How has this job shaped your perception of human beings in Humboldt County and elsewhere?
Oof. Well,
45 seconds.
Yeah, 45 seconds, yeah. So you could probably ask my kids about that, but I think it's made me a little bit of a psychotic parent, a little bit protective, a little bit of those things. It certainly made me aware of my surroundings at all times, but it has also made me a strong, confident person who believes in good.
Yeah.
And I try to hold on to that every single day, even with the stories that we hear.
Well, you're a soldier for good, so
I appreciate that. Thank you.
Thank you for joining us, and thank you for the work that you do.
Thank you.
That's it for this week. Thank you guys for joining us. Don't forget to check out our podcast, Neon Galactic, for conversations that open your mind and revel in deep mysteries. That's at youtube.com/@neongalactic or anywhere you get your podcasts. Stay tuned, stay informed.